Hello, I'm Annette Wilkerson, a student at the University of North Carolina at Greensboro studying public health. I will be sharing information with you about peptic ulcer disease. This project is for class HEA 314. This is just a close-up view of a peptic ulcer. I wanted to share this with you so you would know what a peptic ulcer looks like. As you can see, there's one in the lining of the stomach and one in the duodenum, which is the small intestine. There is no single cause for peptic ulcer disease. Around 80 to 90% of gastric and peptic ulcers are believed to be caused by Helicobacter pylori. Other drugs, such as non-steroidal anti-inflammatory drugs, can contribute to getting peptic ulcers. The NSAIDs are the second leading cause for peptic ulcers. Aspirin is the most commonly abused NSAID, and studies have shown it to cause peptic ulcer disease. Family history can also contribute to peptic ulcer disease. Family history can be specific and polygenic to specific peptic ulcers. Symptoms of a peptic ulcer include abdominal discomforts around the stomach area. The discomforts can be in the form of a burning or dull pain. This usually occurs between meals and during the night. The pain may last for several minutes or extend to several hours. The pain may disappear for several days and weeks before resurfacing again. Some patients may experience a sharp, persistent, severe, sudden stomach pain with a black or bloody stool and vomiting that resembles coffee grounds. This could definitely be an indication of a peptic ulcer and should be reported to the doctor immediately. As you can see, there are many risk factors. Conditions like drinking alcohol, smoking, and using crack cocaine can put you at a higher risk for peptic ulcers. Family history can also contribute to being a risk factor, and age is a risk factor where the older are at higher risk than younger people. Two ways of diagnosing peptic ulcers is non-invasive and invasive. Non-invasive ways deals with family history, the patient being tested for H. pylori through blood tests, the patient doing a barium swallow with an x-ray, the patient's stool being checked for H. pylori. The invasive way is an endoscopy. The endoscopy is performed by placing a long, thin, flexible tube down the throat and into the stomach and duodenum. And if an ulcer is seen that is bleeding, it can be sealed off with a burning tool at that time. These are various methods of treatments for peptic ulcers. Physicians use triple therapy, which is a type of antibiotic treatment. It's a standard treatment in the U.S. for H. pylori-induced ulcers. They prescribe medication for up to 14 days, which is shown to increase the cure rates for peptic ulcers. Peptic ulcer disease affects over 6 million people in the United States annually. Every year, 5 million new cases are diagnosed. It is among the common diseases affecting the U.S. citizens and the world at large. It can cause other illnesses that increase the cost of medication to people and to the healthcare department. Prevalence of peptic ulcer disease by race showed that whites were the most affected group with over 800,000 cases. From 1998 to 2005, there were over 852,000 people above age 65 diagnosed with peptic ulcer disease. The mortality rate for peptic ulcer disease is 6,500 deaths annually. These are the current objectives for Healthy People 2020 for peptic ulcer disease. The target is to have only 46 hospitalizations per 100,000 instead of the 71 per 100,000 as in past years. In conclusion, peptic ulcers are a common illness that affect millions of Americans and many others in the world. It has a moderate mortality rate and mostly affects the elderly. There are several risk factors for peptic ulcers as mentioned earlier in this presentation.